Whether it's arthritis, injury, or wear and tear, your joints tell a story. Sarah Bush Lincoln physician assistant Nick Williams shares how orthopedic care can help you move better and feel better. That's what's next on Being Well.
This is you, and you are why we do what we do. Because the way you feel matters. Sarah Bush Lincoln, trusted, compassionate care.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl is always at the forefront to help you thrive.
Thank you for joining us for another episode of WEIU TV's Being Well. I'm your host, Lacey Spence, and today we're going to be talking about the joints. Very important, often a place of the body that you can experience a lot of pain. But to cover this topic, we have joining us a new guest to the show, coming to us from the Benuti Clinic in Effingham. We've got physician assistant Nick Williams here. Welcome to Being Well.
Oh, thanks for having me. Excited to be here.
Of course, glad to hear it. As a new guest to the show, we love for the audience to be able to get to know who they're hearing from. So can you give us a little background on who is Nick Williams?
Well, I'm a PA. I work primarily with Dr. Peter Benuti down at Sarah Bush Lincoln Benuti Clinic. I've been with him now for about 14 years. I come from a small town in northern Wisconsin. We've come down to this area as my wife is a veterinarian in the local area here, and we've, again, been here 14 years, and I love what I do with Dr. Benuti.
Sure. And so working under Dr. Benuti, his name is on the clinic.
Yeah.
You know, it carries a lot of weight in this area. So
Sure.
What's it been like working and learning under his leadership?
It's like drinking water out of a fire hose. You know, at first it's a really high volume, but he's given me a lot of trust and kind of I've run with that. But he's a great leader. He teaches. He's very kind, and he's taught me a lot this past 14 years.
Well, great. So we're going to put that knowledge to the test today
Sure.
as we're talking about joints and orthopedic care, those sorts of things. So just as a basic to kind of lay the groundwork, in your day-to-day, what types of treatments do you typically offer?
Well, I mean, if you came in, let's say, for example, with knee pain or hip pain, we have a state-of-the-art facility within Sarah Bush in this region. We just start with the basics sometimes. We just get a feel for what you want. You know, how aggressive do we need to be? How bad is this affecting your quality of life? And, you know, we start with the basics with medications. We can go to injections, which we have a slew of injections, different types of injections to offer for pain control and to slow the disease progression down. And lastly, we go back to physical therapy. Again, we have state-of-the-art facilities both here and in Effingham. And lastly, if surgery is indicated, you know, we got a great facility.
Okay, so let's start back at the basic.
Sure.
Just kind of addressing your pain. So if I'm somebody who I've been having this pain, I mean, it's pretty common to, you know, with age, achy joints, that type of thing. But how do I know when it's time to seek further care?
Well, usually I think people come in when it starts affecting their quality of life, or their spouse says you need to be seen because they're tired of listening to you complain. But I think once it starts affecting your quality of life and you know, like, it's, okay, I've tried the ibuprofen and the ice and the heat and a brace and it's just not helping, I should probably be seen. And that's usually when we're seeing people when they've tried home remedies, for example, and it's not helping.
Do you only see older patients? Do you see younger patients? What kind of age range?
So we see, at our clinic in general, I mean, we see pediatrics to, I've seen a 105-year-old, you know, so it's across the board. We'll see anything, and pediatrics to a certain level, of course. But I think with orthopedics, the average age group is anywhere between 55 and 75, 80 years old, I would say.
And in prior seasons, we've also talked about those who are athletes.
Mm-hmm.
So that might skew things down a little bit if they're intense in athletics, or?
Yeah, we have your weekend warriors, those of us that are 30s, 40s, 50s that want to play pickleball, tennis, basketball, whatever. We get those patients, but then we have, Division I athletes at our clinic too. So, and multiple other colleges send their athletes to us. We've got a sports medicine physician, and yeah.
And so do we start with you, or do we start with our primary care doctor?
Well, it depends on insurance, actually.
Okay.
I mean, some require referral and some don't, but we do not require referrals, most of us anyway. Anyone can come see us for that matter.
Okay, good to know. So we've addressed that we need to seek treatment, and there's definitely non-invasive options. You were talking about the injections. Can you kind of explain what those options are, what they look like?
So with injections, sometimes if you have knee pain, clearly there's something called inflammation going on in your knee, and we have ways to calm that down. If medications aren't working, or say medications are contraindicated if you have a kidney problem or a liver problem, injections are rather safe if done right. You can move on to first, which would be a steroid or cortisone injection, as people call it. It's a simple injection. It can last anywhere from 2 to 4 months, but sometimes it can last longer. It's a simple injection. Secondly, there's other injections called HA or hyaluronic acid injections that we can try that kind of adds, if you have arthritis, that is, it can add like a lubricant to your knee. People call them rooster comb or rooster juice injections because of the hyaluronic acid is a derivative of rooster comb, and now we make it synthetically, so that's kind of where that came from. But people still refer them to rooster comb injections, but we get what they're asking for.
Yeah.
Other injections we offer, I think it's maybe tailored more towards sports medicine physician and younger patients, are PRP and stem cell injections.
Okay.
PRP is where we draw your blood, we spin it down, basically inject the good healing properties that your blood has into your joint or into a tendon, which can be very beneficial. We've all been trained on stem cell injections, whether we harvest them from yourself, fat cells, bone, whatever, or we have donor mesenchymal cells we can try. Those are for not so much arthritis, but more for tendinopathies, rotator cuff, maybe a tear in your labrum in your hip. That's like a cartilage tear, for example. So we have a lot of injections.
Yeah, it sounds like you got a plethora of options.
Yeah.
I feel like I remember we've got a couple of coworkers around here have both just had knee replacements, and I remember one of them said that they were asking for the rooster juice. So
Yeah.
I don't know. But when it comes to the stem cell injection, is harvesting that, is that like a painful process, or?
I guess anytime you're going to be numbing someone up and using a way to harvest cells, it can be somewhat uncomfortable, but we do our best to kind of numb the area up and make sure it's rather benign for you.
Okay. And so after that process, let's say I've done injections, how long until I've kind of exhausted, like this Band-Aid's not working anymore?
We go back to, again, I take a very personable approach to this and make sure that you're involved in your care. I give you options. We don't have to do a stepwise fashion. You don't have to do a pill, then an injection, and then surgery or whatever.
Okay.
We can bounce around, and sometimes it depends on insurance. They kind of rule the roost right now with telling us what to do. But if you fail injections, there's other options. We get as aggressive as you want. We have another option that's kind of newer to the area. Right now, Dr. Andy Bays is offering something called iovera. To bring it down a level, there's a nerve in your knee called the geniculate nerve or the saphenous nerve 2 that travels to your brain that says your knee hurts.
Okay.
We have a way to either do it landmark based where we know certain areas, or Dr. Bays is great with using his ultrasound machine to find more of the nerve distribution. And he's able to use a device called iovera where it'll freeze a little ice ball around that nerve. And so by doing that, it can kind of deaden that nerve, for example, for months. Sometimes 3 months, sometimes 9 months, just depends on the patient. There's a lot of anatomy factors that go into this with different patient sizes, if it's going to work better or not. It's a fine option for people that really don't want surgery, or frankly aren't a surgical candidate, or some just, they really don't want to take medicines. It's kind of a borderline holistic approach here with that too, which is fine. We offer those too. I'm fine with the holistic approach if people want to take frankincense, curcumin, which is turmeric, collagen, all these options out there. They have to do their research though, to be careful with that.
No, and I think anytime you can go non-surgical,
Right.
that people's ears perk up because
Right.
nobody wants to be out of work, not able to drive for
Right.
any certain amount of time. When it comes to the freezing of the nerve, so as that wears off, science-wise, does that mean your body is healing that nerve? So
Well,
it's like coming back?
You're exactly right. So nerves can regenerate.
Okay.
There's another way to do it. You can burn it. It's called the geniculate nerve ablation.
Ouch.
We have some, yeah, it sounds terrifying.
Burning
but
sounds worse.
People actually tolerate it very well. I mean,
Okay.
any procedure you're going to get past the medication, you're going to have to know this might sting a bit, but you look at big picture, it's like, okay, if this can get me 6 to 9 months of relief potentially, it's worth that 8 seconds of a sting. You know, it's like going to the
Sure.
dentist. It's going to hurt for a second, but long term, it's going to feel better. But yeah, it's been pretty effective.
And we've covered a lot of non-surgical options, but I hate to ask, are there other options that we didn't cover?
If it goes back to knee pain, you know, physical therapy sometimes can help too.
Okay.
Sometimes we need to strengthen the joint above or below the arthritic knee or the hip or get some range of motion. We have, again, state-of-the-art facilities around here right in your backyard. You don't have to go to St. Louis or Indianapolis, for example, to get good care from physical therapy. And that can also help you with some of your pain. It doesn't necessarily, you know, it's not curative, for example, with arthritis, but again, it can at least prolong the inevitable, which would be a joint replacement.
Well, sure. And as you're talking about having to travel and things, I mean, if you are needing a driver or that sort of thing, trying to get somebody who can take off work and you know go the 2 hours one way or whatever it is, that's great to hear.
Yeah.
And before we got recording, you and I were talking about how there is some expansion to help serve the Mount Vernon area.
Yeah, so I mean, with my 14 years of Dr. Benuti, and I speak to the whole clinic, just not myself here,
Sure.
but you know, we looked over a 2-year period, and I think the last 3 to 5 years, our volume of patients from Mount Vernon and south. Mount Vernon is just as far as I want to drive at this
Right.
point to expand services. So what we did is we put a clinic basically in Mount Vernon. Right now it's just me going there 1 day a week. We hope to expand that for more services or more days of the week. But I wanted a way to reach those southern sector patients more, either help them out by shortening their drive, because some, like you just mentioned, it's difficult to take a day off of work to come see me for your 6-week appointment or your 2-week or 1 year. It's like, I got to drive all the way up there for an x-ray. So by putting the clinic in Mount Vernon, it's been crazy good, almost too good, where I'm now booking several months out.
Yeah.
Where I intended to see you in a week, now you have to wait a month and a half. So people can still come to Effingham or up here to Sarahbush and Mattoon to see us. But our southern draw is just huge.
Yeah.
I think there's something going on down there. There's a lot of physicians retiring, and some other organizations have taken over, and it's changed the dynamic of care down there. And I think we're able to hopefully step in and help them. And it's been great.
Well, and as a rural television station, you know, we serve a lot of rural communities, and
Right.
it's always exciting when we get to share, you know, about new technology, new providers, whatever it is, just to get the word out.
Right.
Because a lot of times the rural communities are the last ones to see the tech and, you know, the specialists. So
Right.
it's great to hear. Circling back to the physical therapy aspect of it, are you able to speak to what can I expect as far as like a regimen? Is it like a weekly thing or?
Again, it's all, we take this from a personal approach. It's you're the driver. Do you want to
Okay.
be seen 2 to 3 days a week, or would you like to learn an at-home program if you follow the rules, basically?
So I can have homework.
Right.
As
If
long
you're
as I do
compliant,
it.
you know, I'll speak to myself. I'm non-compliant at home with PT. But you know, everyone has a job and you're busy. Last thing you want to do is go and do your exercises 3 times a day at home. But you have to look at the big picture. Is this going to help my knee or my hip or my shoulder pain or whatever? And people often do it. But I think when you see your physical therapist twice a week, you're held accountable. And I think they're able to accomplish your goals by getting some better range, or your strength is better and your pain improves.
You can't get back to being a weekend warrior if you don't work at it. You
Exactly.
got to train.
Exactly.
So let's move into surgical options. What kind of role do you play in that? Do you perform?
So
any of
no, I can't perform surgery by law, but
Okay.
as a PA or a nurse practitioner, we have both in our organization.
Sure.
And I think that's why we're so different than a lot of competing organizations is the physician has to trust you, the PA or the NP. We call them AP fees, advanced practice providers, just a simple, make this simplistic.
Yeah.
So our role is I can see you as a new patient in clinic or whatever, diagnose you, treat you, and say you need surgery. So now it comes to surgery day. me specifically with Dr. Benuti is I'm essentially an extension of him. I'm his right-hand man, if you want to call it that.
Okay.
So, he's doing your surgery. I put you back together is what I say. And then we just kind of work as a team. We have some amazing nurses in our OR and our clinic that help us, make us look good, basically. And that's my role. I'm right there beside you. See you in clinic. I'm in surgery with you. I see you after surgery. So the point of this is the continuity of care. You're not seeing someone different all the time. You're not going back to the clinic and saying, well, what happened in surgery? Well, I don't know, I wasn't there. Whereas if you see myself or my colleagues that are working with the physicians side by side, it helps a lot. I think patients build that trust with you. They don't always have to see the doctor, if you want to say that, or the physician. Our roles are there for this reason, is to expand care and allow more volume too.
And I think it's probably good that you took a second to explain that, because I think a lot of people might not understand the difference between the physician assistant, or especially when there's sometimes those titles that fall when you're getting your primary care as well. So you're just like, where is that line drawn? But it almost sounds like you have like a relay race type of thing where you're passing the baton on, like you're still there, but you're still cheering them on.
It's a collaborative agreement, basically. We work as a team. If things get uber complicated, we got our physicians who've been through far more training than we have if needed. We get them involved. But if you're seeing me as your provider in the clinic, I hope you don't tell a difference between myself or a physician. That's the point. We should be giving you competent, good care, and that's our role.
Okay, well then I won't ask about you performing surgery, but as far as what surgical options are out there, can you walk us through those?
So, knee is probably the most common. Hips are out there, but I think we're mostly known for knees for that matter. It can be a simple meniscus tear, which would be, if you need a meniscus tear, think of it as a gasket in your knee, a piece of cartilage that's tore.
Okay.
It could be a simple surgery called the knee arthroscopy. And that's just a less than 15-minute procedure. You're in, you're out, same day. Quick recovery. If things are more advanced and you have pretty advanced, what people call bone-on-bone arthritis, that can happen anywhere from my age to your age to our parents and our grandparents. It's across the board. You don't have to just be an older person to have arthritis.
Sure.
But if that occurs, it's a knee replacement talk. And that talk's a little bit bigger. We got to really set some goals. We have to really be very transparent of what's going to occur on surgery day and what's expected of you as the patient and your family especially too. You mentioned earlier about a driver and someone at home with me. This is a big one, and that's why I think we make this a personal approach, not a joint replacement in a box here. We got to make sure we have case managers that walk the family through it. We have what's called a Joint Center of Excellence, which is like this extra seal, if you want to call it, from the Joint Commission saying that we do a good job, I guess. And with that comes a bone and joint class. You as a patient can go to this class. You sit with others that are having the same thing as you, a knee or a hip replacement. You can bounce questions off each other. We educate the patient on what's expected on surgery day and at home, more than what I can cover probably in the clinic, because I can't spend an hour and a half with you in the clinic going over this. So that's what the class is for. But back to surgery day, we have several surgeons here that do joint replacements. All have a different level of speed or how they do it. With me being with Dr. Benuti, it's kind of a different realm from what he's known. It's what he's kind of a pioneer, the way we do it. But most of us, though, are outpatient. You still come in, you have your surgery. I hope within about 4 to 5 hours, you could be headed home. You don't have to stay the night in the hospital anymore.
Well, and you mentioned the importance of case managers, because you can't cover everything. Just thinking about logistics of like, okay, so you did secure your driver, but do you have any steps getting into your home? Do you have access to a walker? Do you need to get one? Do you, a cane, whatever it is? Being able to think of all of these things, like as a patient, you're already just worried about feeling better, let alone the logistics. So it's great that you guys have that, that recognition that you guys are paying attention to that. As we're in our last several minutes here, is there anything that I haven't asked you about that you think is important for people to know who may be experiencing joint pain?
I would say, I think so many people, I grew up in a dairy farm. My dad's a farmer. They're the last person to come see you. Why? Because it's going to take time away from the farm or home, but also, frankly, some people are scared. They don't want to find out. But it's orthopedics. It's just come in and be seen. Don't be scared. We can offer you options. We're not going to tell you what to do. I think that's the point. I think so many people are scared. They're going to go in, they're going to be told what to do. And we don't have to. If you just want a baseline, see what's going on with you, we have, as we discussed, non-surgical and surgical options if needed. But it's important for people to know we're not, surgery happy. We only do it if we have to. And you make the final decision, not me, if you need surgery. So Point being, don't be scared to come in and see us. If you have an ache, we're here for you. It can be anything for that matter.
Well, not to oversimplify, but it almost feels like you have like a menu. Like
Right.
you've got your varying levels of,
Right.
intensity, but you get to choose where you start. Doctors just provide the information.
Correct. I mean, that's the way that I practice anyway. I think most of them here do too. It's not a dictatorship. We just give you options, hopefully pick the right one and help you with that.
In the time that you've been practicing, have you noticed anything different, changes in technology or anything that stands out to you that
Yeah.
just wows you?
I think technology is definitely changing. There's a lot of advances in medicine right now moving forward. So much of it's not on the market yet, but with surgical options, we have 3-4 robots here within this organization at Sarah Bush, which is amazing. Some other competing organizations, the robot's been out for 13 years. They're just now getting it. So we've advanced on that too.
Mm-hmm. And what's it like for you to be able to see that patients can have that outpatient option, whereas maybe in the past they've had to recover in the hospital 2-3 days before they even try to walk?
And that's it too. So many people, there's mainly 2 questions that say, how long am I going to be in the hospital and how long is my knee replacement going to last? This isn't a 5 or 10 year knee replacement anymore. There's a far less failure rate even at 15 to 30 years than what it used to be. And you're not in the hospital for a week. Again, that's what scares people. They don't want to be in the hospital for 3 to 4 days. You can go home the same day.
Sure. And not in a sense to scare people, just to educate and kind of inform. Do complications ever happen after joint
Sure.
replacement?
I mean, the risks of surgery, we go through that in great detail. Some of the biggest risks are a blood clot in your leg that can form, which we can treat if we catch it fast enough. Infections are always a concern in surgery, but we just don't have an infection rate here, which is great.
Good.
But complications such as joint swelling and increased pain, let's say the medications don't sit well with you. Again, we have several options to help you get through this. People have to let us know.
Mm-hmm. Are there ever times when the replacement, like your body just doesn't react well with it, like it rejects it?
That's a good question. There are very rare instances out there where you can have an allergy to the metal, for example. It's very rare, and we have what you call allergy-free or allergy implants available. There's testing you can do with us to look for that, but again, it's quite rare, but there's sometimes that possibility. There's sometimes, again, this is surgery. These are mechanical joints. Can it debond from your bone, or like the tile on your shower wall, can it remove itself from the grout? Sure. But again, that's a very rare thing that can happen. And we talk about that in clinic of this is why we do it this way versus what it used to be to help prevent these things from happening. I think success rates are phenomenal now for what they used to be.
Yeah. And it's not like, if something were to happen, you guys are ready to jump in with
Exactly.
solutions. It's okay.
And that goes back to my role as the PA or the NP being there. Let's say
Yeah.
the physician's busy or they're out for the week. We are there for you as well. And our nurses are amazing on the phones too, that triage you and find out what's going on too.
And so as we're starting to wrap up here, specifically between pediatric, geriatric, and athletic, like athletes, do you have different ways that you treat each, or is it again just kind of based on the person?
I think it's absolutely, you have to bring it down a level sometimes. I mean, pediatrics, it's like veterinary medicine, it's a whole different world, you got to take a different approach to that. I think with sports too, they're higher demands, so you got to take a different approach, and you just get to your middle age or even into geriatrics, you got to slow things down a bit and give them plenty of options and look at what they want for their quality of life.
Do you have any cases that stick out in your mind? Again, no names or specifics or
Right.
anything, but any case where you've if you had a patient that maybe they couldn't play pickleball like they
Right.
once did, and after going through this, they were able to be the athlete they want to be.
Yeah, I for example, I was about 6 months ago, I saw a gentleman following up for his 2-year appointment. We've done both of his knees. He's 72 or 74 years old. He's going to go and climb Everest for the 2nd time.
What?
Yeah, it's absolutely amazing. His daughter trains people to do this, and he told me, and I said, I need pictures.
I was going to say.
That's great PR here.
It's like, you better take the selfie, you better be tagging Sarah Bush,
Exactly.
tag you.
He's amazing.
Awesome.
We've had several of those too. People that come in, they have to quit their jobs, or they can't do anything, they're on disability, they don't want to do it, and we're able to change that. That's what I love about orthopedics, is we can change you like that. Very simple.
What is is that your favorite memory of the time you've been practicing, or do you have any others?
I don't know. I'm lucky enough and fortunate, I think. I see so many people during the week and through the year that there's so many stories like this. It's just great to see someone come in severe pain, or they're just depressed, for example, and we're able to change that. I mean, it's amazing. People don't want to talk about that, what this does to your psyche, if you want to say that, or your body as a whole. Simple orthopedic problem can change your life.
Well, physician assistant Nick Williams from the Venuti Clinic, thank you so much for coming on Being Well today. You've answered my questions fantastically, and we appreciate your time.
Oh, thank you very much. Thanks for having me.
Of course, and we thank our viewers for joining us for this episode of Being Well. Hopefully you've been put at ease if you've got some achy knees or shoulders, joints, those sort of things, that you've got options. So we thank you for joining us again, and we hope you'll join us next time for another episode of Being Well.
Carl is redefining healthcare around you, innovating new solutions and offering all levels of care when and where you need it. Investing in technology and research to optimize healthcare, Carl is always at the forefront to help you thrive.
For over 50 years, Horizon Health has been keeping you and your family healthy. And although some things have changed, Horizon Health's commitment to meet the ever-changing needs of our community has remained the same. Horizon Health, 50 years strong.
This is you, and you are why we do what we do. Because the way you feel matters. Sarah Bush Lincoln, trusted, compassionate care.